Hello, I'm Dr. Hanume Gowda, consultant orthopedic surgeon practicing at AHA Orthocare, Nagarbhavi, Bengaluru, specialized in joint replacements and spine surgeries. Wrist joint is one of the most mobile joints in the world. It's just second to the shoulder. Shoulder is the most mobile joint, after that is the wrist joint. So injuries or problems with the wrist joint is very, very common. Injuries can happen with simple snapping of the wrist like that, or during a sporting event, or when you just try to get up and put too much pressure and the hand twists a little bit. Such small things can lead to major injuries in the wrist joint. So you have to take care of the wrist very much. The most common causes of wrist joint pain is unknown, in the sense without any reason you will get a pain. But when we dig deeper, we find out that there was an injury in the past, or there is some sort of event which had happened and slowly it has evolved. So wrist pains can evolve over time, or it can be acute. Evolving over time is an injury in the past, a minor injury can lead to slowly developing into a major problem and will show up later in life. This happens because there are around 10 bones in the wrist joint with so many combination of joints. Some of them are mobile joints, some of them are just gliding joints. Gliding joints are they just move a little bit like this, not much of a joint. Some of them are mobile, a lot of movement can happen. So wrist pains should be taken care as early as possible. Small little problems of the wrist should not be ignored. The other cause of wrist pain will be arthritis, which is a very common thing in the society. Arthritis can happen to anyone. The arthritis usually occur in multiple joints, does not happen in one single joint. Then they are also called inflammatory disorders or autoimmune disorders. They all come in one group. Autoimmune disorders, inflammatory disorders, or arthritis problems. Usually if you get it in the right wrist, you will end up, or you will simultaneously getting it in the left as well. It can involve the hand joints also. Then the other causes are, nowadays the tech wrist or the tech thumb problems, or the texting thumb and texting wrist problems have become very common. Pain because of too much of finger movement in a constant position of the forearm. You keep the forearm in a constant position and keep moving your fingers and wrist can lead to pain. These are all usually related to muscular imbalance and sometimes inflammation of the muscle. So it's called tendinitis and myositis, which is very common these days. Then there is something called a carpal tunnel, which is again in the wrist joint. There is a nerve which goes through the carpal tunnel, which is bounded by the bones. There is a very tight tunnel there. There is just enough space for the movements, and in that, if there is an inflammation because of constant rubbing of your wrist on a mouse pad or on the table or anything of that sort, can lead to pain in the wrist and also in the hand. Wrist pains are common, can be treated. There are effective treatments available. There will be complete cure of your wrist pain. But the problem is, we should always try to find out what is the problem, and accordingly if we give treatment, all wrist pains can be treated, either with medications or physical therapy like exercises and heat therapy, or with a surgery. The treatment may be different, but all wrist pains can be treated effectively. About the exercises or the stretching or the home remedies that you can do for wrist pain, it can be a little bit dicey because I don't see much of exercise that you can do for the wrist. If at all it is a tendinitis problem, as I said, overworking in the same position using your fingers like typing or texting can lead to a little bit of imbalance in the muscles. There you can do this stretching, complete extension of the elbow and stretching, flexion of the elbow and stretching, then stretching on the opposite side, stretching the thumb completely. But remember, don't do any jerks, don't try to snap the wrist, don't try to snap the fingers, getting sounds out of it. Just do gentle stretches, hold it for a couple of seconds and leave it alone. If this is not relieving your pain, then you will have to see a doctor. As I already said, wrist pains can become a problem because for each and every movement of your hand or the wrist, for any work that you want to do, your hand and wrist is very important. So take care of your wrist. Don't wait for the wrist pain to become bad or stretch for a longer period, because later on it will all be difficult to treat, like surgeries, and though you get a good relief, there will be some sort of deficit which will be there. So initially, as early as possible, you take care of it, it's better. Carpal tunnel syndrome. Carpal tunnel syndrome is, carpus is the wrist joint where there are about 8 bones aligning with the forearm bones. That area is called the carpus, where there is a tunnel which is bound by bones on one side and a thick tissue on the top of it. It's like a tunnel this way with a thick tissue sitting up there. There's a nerve which passes along with a lot of tendons. There is very little bit space for all these things to move, but enough space for them to move. Now, whenever there is an inflammation or an infection or a swelling or an injury into that area, this nerve can get compressed. This can happen because of multiple problems. First is the injury, second is RSI. RSI is repetitive stress injuries, where tendinitis of the finger muscles, the muscles for the finger come from the forearm here, that goes along the carpal tunnel and go and get attached to the finger. So this movement can lead to swelling there and lead to carpal tunnel problems. Then there are other causes like inflammatory disorders, rheumatoid arthritis and other arthritis can also lead to swelling there and carpal tunnel syndrome. There's also infections that can happen in that area. And the last one, very important amongst the ladies which we see, is hypothyroidism. Thyroid which is low in your body, thyroid and hormone levels are low in your body, can lead to fat deposition in these areas and can lead to carpal tunnel syndrome. Carpal tunnel syndrome treatment is very simple. You'll have to find the cause for it and treat the cause. There are two things. One is a organic problem, the other one is a mechanical problem. Organic problem is because of inflammation, infections or hypothyroidism. Find the reason, treat the cause, the swelling will come down, your carpal tunnel or the median nerve gets decompressed by itself. That's called medical decompression. Then there are mechanical situations where the tunnel has become very tight, there is no space for the nerve to breathe, and it's become a permanent situation where you can't give medications and relieve the compression inside the tunnel. That's when you'll have to go in, and as I said, that is a tunnel with a thick band on the surface. We'll have to release the band and give space for the nerve to breathe. So this is by and large the regular treatment that we do. In between these two, there are a lot of physiotherapy methodologies that can be done also. All these things are effectively done to relieve the swelling in the carpal tunnel so that you get a little bit more breathing space for the nerve. So for the carpal tunnel syndrome, occasionally we need a surgery to relieve it. Surgery will be, there will be a thick fascia on the tunnel that has to be incised, and little bit of space is provided for the nerve and the tendons to move about so that the pressure or the compression is relieved. This can lead to a little bit of the tunnel becomes wider and the nerve gets decompressed, and the symptoms of the carpal tunnel is completely relieved. The problems with surgery is that it is a surgical procedure which involves some sort of anesthesia, sometimes local, sometimes general anesthesia. There are a lot of complications that can happen, but by and large, as of now, the complications are very, very, very low. The other complications because of surgery is, while incising the fascia, accidentally people may injure the nerve. So experts who are known to do these things regularly, who know the exact procedure, where to approach, which part of the fascia to be cut, has to do this surgery. Not everyone can do this surgery. The other thing is recurrence of carpal tunnel syndrome. Once we cut the fascia and relieve the compression, slowly the tissue may grow back, and it can become again a tight compartment, again compression may occur. It's a very rare situation, but it can happen. The other problems that can happen is because of the fascia that has been cut, the nerve becomes a little bit superficial. So whenever you touch your wrist like this on a surface, you might get a shock sensation. Very rare, but can happen into the into these three, thumb, index and the middle finger can have little bit of numbness once in a while when you touch it. Like what happens when you hit your elbow to the side and you get a shock like sensation, that can happen. The last one is infection. Because it's a soft tissue surgery, there can be infection, but very rare, effectively can be treated without much of complications. One of the causes for wrist pain is sporting activities. Cricket and tennis are the two sports which are commonly played around in India at least, and of which cricket and tennis can lead to a lot of wrist injuries. That's because you use a heavy bat or a racket which will be hit by a ball which is coming at a high speed. When that happens, if your wrist is not in a stable position for whatever reason, if you are not holding this racket in a very stable position, it can lead to increased movement on either ways and can lead to wrist injuries. Then there is also called tendinitis. Each and every tennis player goes through tendinitis problems of the wrist at some point of time during his career. All these are youngsters and their career sometimes can get ended because of these tendinitis problems. It can become so serious. So the position of the wrist while playing is very important. The main cause is tendinitis and wrist joint injuries. There are a lot of ligaments in the wrist, and also there is one important ligament called the TFCC, triangular fibrocartilage ligament, which can get injured. If that gets injured, surgery is the only way you can get better or you can get back to your activities. So taking care of your wrist, particularly during sporting activities, more so during tennis playing, is very important. So how do we take care of this? First of all, you'll have to start using a wristband or wrist strap while you initially start playing tennis, so that you get some sort of support while playing. Over the time, when you realize that you are getting stronger and you are getting better, you have got a technique, you know how to hold the racket, how to play, then probably you can do it with the wrist bands or wrist straps. That's the first thing. Second thing is, when you get injured for whatever reason, because once you get injured when you're playing, it happens because all sports involve some sort of injury. So if it happens earlier, you take care of it better. Sometimes it can be as simple as giving rest for a few days, because the tendons or the muscles would have got inflamed, it will settle down. Sometimes the capsule of the joint, there is a capsule around the joint that could have got inflamed or swollen. That can be also relieving tablets and little bit of rest. Sometimes the rest can go off for 3 to 6 weeks or maybe a little bit longer also, but the rest as and when required should be taken. Your sports medicine expert or the person you are consulting for sports medicine will be able to tell you exactly how many days it will require, depending on the type of injury. If it's a bony injury, it will take longer time. If it's a joint injury, it will take a little bit shorter time. Ligament injury will take a little bit more shorter time. So all these things are time bound based on what sort of injury you get. Wrist pain during sporting activities, the moment you get injury, sometimes because of spasms of the muscle or sometimes because of the tendinitis, you can stretch it a little bit, use pain balms or sprays or gels and do a gentle massage. Heat therapy also will help you. But if the pain is not getting relieved for more than 24 to 48 hours, it's better to meet a doctor, because there can be something deep and more damaging if you continue to play the game. If there is a partial injury of the tendon or a ligament, if you continue to play, it can get a complete injury, then that can jeopardize your career.